Welcome to the Disability Support for Older Australians Annual Review instructional video. This short video has been designed to show you what the department requires in your client's annual review. The department has now introduced an annual review template. You're welcome to use the template provided. However, we will also accept custom templates created by your organisation. Just make sure to provide the same key information. Before we start, we want to remind you of your compliance obligations. DSOA service coordinators are responsible for responding to the client's support needs. This includes the development, maintenance, and review of the client's individual support package, delivering services directly and/or through subcontracting arrangements, making sure special needs groups have equitable access to services. DSOA service coordinators are also responsible for all quality and safety aspects of service regardless of how it is delivered or who delivers it. This includes application of high-level duty of care, management of and timely response to emergency situations, registration with the NDIS Commission and compliance with their standards, developing and continuously improving service delivery. If you watched our ISP instructional video, you would know that an ISP is a record of the agreement between you and your client about the services they receive through the DSOA program. Knowing the services and the funding available helps your client make an informed decision should they wish to make a temporary or permanent change to their DSOA package. ISPs must be reviewed and updated at a minimum annually or more frequently if your client has had a change in their support needs or funding levels. An annual review is your assessment of your client's needs to determine whether current supports are meeting their disability support needs and whether any changes are required. Completing an annual review of your client's needs can help reduce the risk of an incident occurring and is required to support a change of needs application. The requirement to complete an annual review of your client has been a condition of your grant agreement since the DSOA program commenced on the 1st of July 2021. It is a requirement for DSOA service coordinators to conduct an annual review of services with each client, their carer, advocate, or nominee. When completing your client's annual review, it is important that it is detailed and comprehensive, like the examples shown here. When reporting on your client's disability, include your client's primary diagnosis as certified by a qualified health professional. Your client may also have secondary disabilities, which should also be listed. Medical conditions are described as a health condition dealt with by medical professionals and may involve inpatient care or continued treatment. Make sure you identify all medical conditions your client manages. What DSOA services does your client currently receive? You can find these in your client funding breakdown and are listed in your client's individual support package. Is your client accessing support through other government programs? Do they receive informal support from family, friends, or support networks? How does the client communicate? Your client may be non-verbal, hearing impaired, or speak English as a second language. We want to know how your client communicates and how you communicate with them. What is your client's current functional capacity? It is common for DSOA clients to have mobility and transfer difficulties. How do they mobilise, and are they supported by assistive technologies? What is your client's current personal care needs? You must explain why they need care, how it is delivered, and by who. List whether your client demonstrates behaviours of concern and make note of any restrictive practices in place. Please note, DSOA service coordinators, including subcontractors, must register and comply with the NDIS Commission's requirements. This includes establishing a comprehensive behaviour support plan for their DSOA clients where required. Please refer to the NDIS Quality and Safeguards Commission website for more information. Finally, report whether your client's current DSOA supports meet their needs and goals. If not, what changes are required? Having an open, two-way conversation will help identify any changes to the client's support needs since their last annual review. Please note, if your client has had a health crisis, episode, or any changes in their disability support needs, you need to report this in your client's annual review. We also need you to tell us if there have been any changes to their carer or living arrangements. Thank you for watching our instructional video. Your annual review can now be submitted to DSOA compliance at health.gov.au. Please note, a client's annual review must be emailed to the department within 10 days of it being completed. Further information about client annual reviews can be found in Section 3.2 of the DSOA Program Manual.